So there are several differences between a specialist plastic surgeon and a cosmetic surgeon. I think the first and foremost one is really the rigor of training. So as a specialist plastic surgeon, I had to work in a junior capacity, like an intern resident, for the first 2 years. You were then allowed to apply for the training scheme, but often you had to have a lot of experience before that. Once you did get onto training, there was 5 years of training, much like if you're a heart surgeon, brain surgeon, orthopedic surgeon. And then at the end, there's a very, very rigorous exam before you qualify. And most surgeons like us would then go on fellowship training. So for example, I did 6 months in Canada and a year in the US doing further breast surgery as my area of expertise. So all up, that was about 10 years beyond medical school. And what that got me was I'm very lucky to have the jobs I have in two very big public hospitals in Sydney and also a private practice. So it does mean that my patients are certainly very well looked after, but if they should have any complications, 24/7 we'd have someone who'd be able to look after them. And I guess that safety aspect is the real key. I guess the other difference is hospitals and where patients will be looked after. As a specialist plastic surgeon, all hospitals will recognise that training and they will give you accreditation, whereas cosmetic surgeons may not have that unless it's their own facility. And patients don't often know that until there is an issue that requires admission, in which case they may be asked to go to a local public hospital. So I really do think that patients should be aware and do their research and look out for that safety aspect. Unfortunately, cosmetic surgeon is not a real title. It can be used really by anybody. It can be used by a GP with an interest in cosmetic surgery, or even just a medical graduate who's done some coursework or a weekend type tutorial on cosmetic surgery. And so because of that real difference in training, the title that we hold as a specialist surgeon is protected, and this will be reflected in the care you receive.